Nirmalaka left.
Yes, we are live now. Yeah.
We are? Let me
Yes,
just.
we are.
Hi, everybody. I'm just checking if the channel is live once. If it is active, then we can go ahead and start our session.
Wait, I think it's playing the recording or something. I'm not sure. It's not showing your face. Yeah, now you're there.
Is it?
Yeah, there's a delay in it, so.
I'm not able to see it.
Go to the link and try. What's up? What is the latest link now?
What link are you using, Shruti? Is it working?
Yeah, it's working. We're live now.
What link are you using?
YouTube. No, the link.
Which link?
Let me just send it to you 1 second. Can you just check your chat? I sent the link.
WhatsApp, please.
Open it and see. Yeah. Send out this to everybody. That's Santosh to send it to everybody.
Hi, I think we can start now. Shruti, are we ready to start?
I think you're on mute.
Yes, you can.
Shruti, can you make the speaker view, please?
Yeah.
Good evening to each and every one of you who have joined us today. The 7th of November every year is observed as the National Cancer Awareness Day. And in light of the same, we, Lions Club of Bangalore-Aikya, supported by District 317E of Lions Club International, headed by DG Banumurthy Reddy, are conducting a webinar on cancer awareness. I welcome each and every one of you to this event. We have with us today Dr. Raghunath SK, a renowned uro-oncologist, as our guest speaker. Dr. Raghunath is currently the Director of Department of Uro-Oncology and Robotic Surgery at HCG Cancer Hospital. He is also the co-founder and director of Trustwell Hospital in Bangalore. Dr. Raghunath SK completed his MBBS in 1993 and his MS General Surgery in 1998 from Government Medical College, Mysore University, Mysore. Dr. Raghunath completed residency in urology in 2004 from Muljibai Patel Urological Hospital, Nanded, Gujarat, and his fellowship in uro-oncology from Rajiv Gandhi Cancer Institute and Research Center, Delhi. He was then selected for fellowship in laparoscopic and robotic urology at Taipei City Hospital and Mackay Memorial Hospital, Taipei, Taiwan. He was a visiting fellow in molecular oncology for prostate cancer at Center for Prostate Disease Research and Walter Reed Army University at Maryland, Washington, D.C., USA, from April to May in 2013. Dr. Raghunath has conducted more than 18 clinical trials in the field of prostate cancer and renal cancers. He has more than 20 national and international publications to his credit. He has authored many chapters in many uro-oncology books. He also served as the Honorable Secretary of the Bangalore Urological Society in 2013 and was also the president of the same in 2017. He is the co-founder and one of the four directors of Trustwell Hospitals, JC Road, Bangalore. It is a 220-bedded state-of-art multi-speciality hospital in the Central Business District of Bangalore. Dr. Raghunath is the founder and chairperson of Global Prostate Disease Foundation, an NGO to create awareness about prostate diseases, in particular prostate cancer, amongst urologists and the community to prevent and detect prostate cancer in its early stages. He is also a TEDx speaker and gave a speech on robotic surgery at Dayanand Sagar College of Engineering in 2019. The questions Dr. Raghunath will be discussing today with us are: what is cancer? What are the risk factors involved? Do lifestyle changes help in preventing cancer? How to detect cancer in the early stages? And in the second part of his discussion, he will be talking about prostate cancer in detail and its significance in our society these days, as it is the month of November. I now request Dr. Raghunath to address us. Thank you, sir.
Very good evening. At the outset, I would like to thank Sahiti Madam and Lcb-Aikya for this opportunity. I would be speaking on just cancer awareness. I don't like to get into the details of every cancer. I will just give overview of cancers, how it is going to cause cancers, what are the risk factors, how to prevent it, and what are the stages of cancers. And in particular, I would like to touch upon prostate cancer. So to begin with, understanding of basics of cancers, all of you will have these questions in your mind. What is cancer? Cancer can be prevented. Is it possible to prevent? How is cancer diagnosed? What are the risk factors for cancer? What does cancer stage means and why it is important? How does cancer spread from one organ to different organs? So all these questions you will have in your mind. We are going to address these basic questions for your better understanding. What is cancer? Cancer is an abnormal growth of cells. Each cell contains a set of instructions. Our body is full of cells. More than trillion cells will be there in our body. And each and every cell has its own immense memory that is called DNA. The instructions tell the cell when to reproduce and when to die. Even in case of any trauma or any cut in the skin or any organ, it heals. After the healing, it stops producing the cells. That kind of very sophisticated memory is present in each and every cell of our body. Sometimes these instructions from the DNA can be damaged and can result in what is called mutations. So we in medical term called mutations, that means abnormal DNA sequences in the cell, from where we get the instruction, from where the each and every cell get instructions. If cells keeps reproducing in an uncontrolled way, it forms a mass. Once it forms a mass, that is nothing but a lump or mass, that is nothing but cancer or a tumor. So it doesn't stay at that particular site. It gets its blood supply from the host, that is the body, and it starts spreading to other parts of the body. That is in just what is cancer. Coming back to the normal cell growth, to differentiate cancer from normal cells, this understanding is very important. Normally, your body tells itself to stay on cell multiplication control. There's a perfect control, perfect balance, very well programmed control is there within our body. So cell's cruise control maintains a steady, orderly speed and always stays in the line in a perfect order. Whenever 2 or 3 cells are removed from the body, only 2 or 3 cells will be replaced. There will be a very perfect balance in the number of cells, depends on the body's requirement. What will happen in the cancer? The cells are reproducing at a much faster rate than required, than necessary. This equals higher speed without any control, without any brake, without any speed control. If cells are going too fast in traffic, a pileup can happen, which happens similar to traffic. This cell pileup is called tumor. Aggregation of unwanted cells in excessive number. You can make out from this photograph, there is a disorder, there is more number of cells. So this disorganized, more number of cell growth forms a tumor. So coming to the different types of tumor. So we generally know about cancer, but there are some benign tumors, non-cancerous tumors. So benign tumors are non-cancerous tumors. So they do not spread to other parts of the body, unlike cancer cells. And they are usually not life-threatening to anybody's or a patient. In contrast to that, malignant tumors we also called cancers. So cancers means it is always malignant tumor. Benign tumors cannot be cancers, which reproduce without any control, without any order. So cancer cells can spread to other parts of the body through various routes, through various mechanisms. So why does we get cancer? What are the causes of cancer? So we call in medical terms hits. In layman term also we can explain over a time cell takes many hits. The hits come from various factors. So what are when we are exposed to a lot of environmental factors, occupational factors, radiation and viruses and bacteria, this hit can take on the normal cell that can get converted into a cancer cell or a tumor cell. So how you live, it also depends on these factors, whether these cells are get exposed to tobacco, what are the dietary factors, alcohol, and our activity, body activity. So all these parameters decide what kind of hit our normal cells is going to take place. So that determines whether the normal cell will get converted to a cancer cell in future. It happens over a period of maybe a decade or 2 decades. It doesn't happen if I start smoking from today, I may get probably cancer maybe 10 years, 20 years, or even 30 years later. So that is the time period where these changes happens within the cell. What are the most common risk factors? This is, I've taken this from a global perspective. This may not be truly reflects in Indian scenario. You see, diet is responsible for 30 to 35% of cancers. The second most common factor is tobacco, which again contributes to around 30 to 32%. So it is easily possible to modify our diet and it's possible to quit tobacco or not to get exposed to this tobacco. These two modifiable risk factors, what we call it as modifiable risk factors, where we have some control over these two things. If we take control of these two things, 65 to 70% of cancers can be prevented by controlling these factors. What are the other risk factors? There can be viruses or bacterial infections, particularly HPV infection for cervical cancer and some male genital cancers. It also depends on sexual practices. Sexual practices can cause sexually transmitted diseases, and alcohol can cause 3 to 4% of tumors. Industrial occupations where the person can get exposed to industrial toxins. Environmental pollution, sitting in Bangalore, which is very, very important because of vehicular pollution, carbon monoxide pollution. Probably in Bangalore, this is not 2%, this will be much more than that. Any history of family history of prostate cancer? There are familial cancers, particularly familial kidney cancers, familial prostate cancers. If father is having prostate cancer, the risk of son developing prostate cancer or daughter developing breast cancer is relatively high. That is the meaning of family cancers. Food additives, this is very important. Generally, most of the major cities, many people would eat in the eateries or restaurants. So what will happen? They add, for the aesthetics and for the taste, they add a lot of additives. These additives are responsible for some cancers. Exposure to radiation, of course, radiation, we get exposed from everything. Every electronic gadgets emit some radiation. So we are surrounded by many of these gadgets, starting from mobile phone, which we use commonly, any other electronic equipment in the household or even at workplace. How is cancer diagnosis made? A cancer diagnosis can only be made by looking at the cells from a biopsy under microscope. Whenever we want to diagnose a cancer, we take a piece of tissue from the tumor or from the mass, and it will be studied under microscope by a pathologist, and they give the report whether it's normal or cancer, or whether it's a benign tumor or a cancer. This is very important. We address this cancer with various organs. We generally call it a prostate cancer, breast cancer, colon cancer, ovarian cancer. All are cancers only. How do we differentiate? Most cancers are identified by the organ in which they first begin to grow. If the tissue or the tumor starts beginning from the prostate, we call it as prostate tumor. When it starts beginning to grow from the breast, it is called breast cancer. These are examples of solid organ cancers. How does cancer spread to other parts? Generally, uncommonly, it spreads to adjacent organs by a contiguous spread or direct spread. The prostate cancer can spread to bladder. Prostate cancer can spread to rectum because these two organs are adjacent to each other. The other commonest way how cancer spreads is through lymphatics. Lymphatic channels are similar to blood vessels. These are very tiny channels within the body. It goes through, the cancer cells goes through these lymphatic channels to the lymph nodes, and eventually it goes through the bloodstream to various organs. Commonly, the kidney cancer goes to the lung, and prostate cancer commonly spreads to the lymph nodes and bones through these mechanisms. What are the risk factors? We generally or broadly classify these into modifiable and non-modifiable risk factors. This includes habits, our behaviors, and our practices. Where one can change these factors, it is possible to modify these factors. By modifying our lifestyle or our practices, it is possible to prevent these. Coming to the diet, red meat, it could be mutton, it could be beef, or it could be pork. So by eating red meat, it is known that it increases the incidence of cancers. Generally, it increases the incidence of cancers. And now we eat all the vegetables. Without pesticides, we can't grow any vegetables. We have unfortunately reached the stage. So all these vegetables contains, whether we want it or not, a lot of pesticides. According to recent survey from India, pesticides are responsible for almost 10 to 12% of cancers. And the milk which we drink nowadays is adulterated. The Nandini milk is approximately adulterated, according to one report, around 21%. It contains a lot of antibiotics, it contains a lot of chemicals. So whether it's safe to drink all these things, one has to decide. The body weight, high body mass index, we call it as body mass index, weight compared to the height of an individual. If it is more than 28 to 30, the risk of development of cancers will be relatively high. Particularly, the kidney cancers are very well known to produce in these high BMI individuals. Physical activity. A person with a sedentary work is likely to develop cancers compared to a person who is very active, who does exercise regularly. This is a relative phenomenon. It is not that all sedentary work people would develop cancer. It is not like that. When you compare with sedentary workers with person who is very active, the person with sedentary work, he is likely to develop cancers in a relative fashion. Exposure to the sun is very, very important. Vitamin D plays a major role in prevention of many cancers, in particular prostate cancer. The smoking can cause any cancer because the smoke contains more than 60 to 70 carcinogens. Even the paper which is used in cigarettes contains more than 200 carcinogens. Carcinogens means cancer causing factors. We call it as carcinogens. So this cancer causing or carcinogens are present in not just the tobacco, it also present in the paper which is used for cigarettes. It generally causes oral cancers, lung cancers, and bladder cancers. And again, frequent or more consumption of alcohol, consuming alcohol excessively, can cause these cancers. Uncontrollable risk factor, where it is not possible to modify these things. Though these are the risk factors that cannot be changed or controlled. Age, we don't have any control over the age. We don't have any control over the gender. Age, generally, many cancers are seen in elderly individuals. Particularly prostate cancer is common after the age of 65 years. Even the kidney cancers are common after the age of 45 to 50 years. It is very rare to see in younger individuals. Whereas some cancers are there which are unique to children, particularly Wilms tumor, which is a type of tumor in the kidney, which we see in 2 to 3 years age group kids. And when it comes to gender, predominantly males are at relatively higher risk of developing these cancers compared to women. Ethnicity and hereditary and familial cancers, which I already addressed. When it comes to ethnicity, African race has relatively higher incidence of any cancers, in particular prostate cancer. What are the genetic risk factors? What do you mean by genetic risk factors and how does it happen? It happens because of abnormal genes. How do we get abnormal genes? At birth, whether these genes are abnormal or we acquire these abnormalities at a later date in the life. So it is very important to discriminate these two. When we acquire from our parents, that is called, we got these abnormal genes from our parents, or sometimes because of environmental exposure, these genes will become abnormal. So this happens by exposure to carcinogens, or otherwise called cancer causing agents. So how does our genes or genetic makeup of an individual at a particular organ changes? The certain viruses can cause cervical cancer, particularly human papilloma virus, HPV virus. It could be sexually transmitted. So when we get exposed to this HPV virus, it produces cervical cancer. The radioactivity and ultraviolet radiation, which we are abundantly exposed to in day-to-day life, can also cause damage to this DNA, which can cause tumor. Chemicals found in tobacco, smoke, pesticides, and some workers who are exposed to asbestos in the factories can develop particular cancers. Toxic chemicals which are present in the plastic bottles and paper cups. If we freeze the plastic bottle in a refrigerator, one carcinogen called dioxone will be released into that water, whether you freeze water or even the milk. That chemical from the plastic is released into the either water or whatever the fluid which you are going to store. When you ingest that, in the long run, maybe 20, 30 years, that can cause cancers. And even the paper cups, when we drink hot coffee or hot beverages, it releases some chemicals that also can cause these cancers. So why I'm telling all these things is regularly in our routine day-to-day life, we are using all these things. My sincere request is kindly avoid all these things so that we can control our health in a better way. We can prevent most of our cancers, probably up to the tune of maybe 60 to 70%. That's very important. What are the warning signs of cancer? We know what is cancer. How do we get cancers? What are the risk factors? Now, what are the warning signs? Generally, mnemonic is a caution. So I'm going to tell you, C stands for change in the bowel or bladder habits. So some people can develop constipation or diarrhea, or sometimes there can be blood in the bowel or in the urine. So there can be colonic cancer or intestinal cancer or bladder cancer. So change in the bowel and bladder habits can cause this. A sore that does not heal at any part, either in the limbs or in the abdomen, wherever it is. So we should not neglect it. If it is not healing, maybe within 15 days or 20 days, better you take an opinion from a doctor. Unusual bleeding or discharge from the usually discharge bleeding through the urine or through the motion or nose or ears, or sometimes it can be from the nipple. In case of breast cancers, there can be early breast cancers. We should not neglect any bleeding or any abnormal discharge from any side. Thickening or lump in the breast or abdomen. Of course, breast by self-examination, which is very important for women, just by examination of their own breast or their own organs, even testicular tumors can be prevented. Can be detected early by self-examination. That is very important. And indigestion or difficulty in swallowing can be sometimes due to esophageal cancers. So any abnormal symptoms, if it is persisting for more than 3-4 days, better to take opinion. Obvious change in the wart or mole in case of skin tumors. Whenever all of us will have a mole, if mole starts growing suddenly, if it is increasing in size rapidly, so that could be one of the signs of skin cancer. And nagging cough or hoarseness can be early warning signs of it could be lung cancer, it could be thyroid cancer. So these are general warning signs of cancer. There are many other symptoms, and most of the times, particularly when it comes to prostate cancer, early prostate cancers will not have any symptoms. So even if you undergo regular screening yearly, you can probably prevent 70 to 80% of, you can early detect 70 to 80% of cancers. Even if you do regular screening, some cancers can be missed. So at least whenever you look for these warning signs, you can probably detect these cancers in an early stage. When it comes to treatment of cancers, what are the general treatment options? Generally, surgery is there. Surgery is a removal of the tumor from where it is arising. Chemotherapy is generally employed for advanced stage tumors. Radiation therapy, when it is confined to one organ, either after surgery or directly, we can go for radiotherapy. When it comes to prostate cancer and kidney cancer and other tumors, we have hormone therapy, immunotherapy, and targeted therapy. And now we have immune checkpoint inhibitors, which are new type of molecules, which enables our own body immunity to fight against the cancers. So usually this can be used in a combination or individually we can use, depends on the type of tumor, depends on the stage of the tumor, depends on the requirement for that particular individual. So as I told you, how we can prevent cancer, my sincere request is stop smoking, avoid alcohol. If you're taking alcohol, if it is very difficult to leave, at least reduce the consumption, reduce the frequency. Eat more vegetables and decrease the fat, particularly organic food can probably decrease the risk of developing cancers. Exercise is very important, at least 4 to 5 days a week, 30 to 45 minutes every day. Brisk walking should be good enough, or if gym is available, probably by going for strenuous work, probably you can avoid these tumors. Stay active and maintain a healthy weight is another factor which we can easily control if we have this particular knowledge. Apart from all these things, sometimes we will not, despite of doing all these things, one can develop cancer because of genetic factors, which we don't have any control over those genetic factors. So to identify those things, screening is very important. Every yearly, it is recommended after the age of 40 or 50 years, depends on particular cancers. I will come to that when I start discussing about prostate cancer. So these are the general factors about cancers. So let me come back to prostate cancer, because I deal with prostate cancer. I treat many prostate cancer patients, and now the increasing trend of prostate cancer is seen in Indian patients, particularly according to recent Globocon data, 2018 data. Bangalore, Pune, and Delhi is second commonest for prostate cancers amongst men. So 10 years back, 15 years back, it was in fifth or sixth place. Now it has jumped to second place. So we see many prostate cancer patients in our clinic. It is really alarming. So let me discuss about prostate cancer. First, many of you may not be aware of prostate gland. What is prostate gland? Where is it? Where it is situated? It is nothing but a gland which is situated in the abdomen, lower part of the abdomen. We call it as deep pelvis. It's called bony pelvis. It is situated just below the urinary bladder. Urinary bladder is an organ where urine is stored. It presents below the bladder. You can make out from this is the bladder. Just below that is the prostate. We can feel the prostate just by inserting our finger into the rectum. So it is easily accessible for examination. Another thing, what you should know is the urine from the urinary bladder flows through the prostate. So whenever enlargement of the prostate is there, whenever cancer is there in the prostate, this causes obstruction to this urine flow. That is one of the symptoms of either enlargement of the prostate or prostate cancer. So coming to the enlargement of the prostate, because I will just spend 30 seconds on enlargement of the prostate, and then I will touch upon prostate cancer, because it is very important to discriminate any enlargement of the prostate, is whether it's benign enlargement or cancerous enlargement. So benign enlargement, meaning to say it is non-cancerous enlargement, is very common. Almost 75 to 80% of men will have enlargement of the prostate during their lifetime. Every man will have approximately 75 to 80% of them will have enlargement of the prostate, which can be non-cancerous. Okay, it is very important to discriminate whether it's non-cancerous or cancerous when it comes to enlargement of the prostate. So this starts enlarging after the age of 50 years. You can make out from this photograph, this is normal prostate, where the passage of urine flow is wide open within the prostate. When the prostate is enlarged, either due to benign enlargement or because of malignant enlargement or cancerous enlargement, it causes obstruction to the urine flow. So patient or person will experience symptoms which is due to obstruction to their urinary symptoms. What are those symptoms? So generally they pass urine with a very slow stream. They try to strain to pass urine. They apply a lot of pressure, and due pressure will be required to pass the urine. Generally, after the age of 50 years, person can get up once or twice, whereas with enlargement of the prostate or with the cancerous prostate, their frequency will be more. We call it as nocturnal frequency, or night frequency will be 3 or 4 times. To initiate the stream, they generally wait for a couple of seconds. They can't initiate the stream, urinary stream, as soon as they reach the restroom. They wait for some time. That is called hesitancy. And some people can have urgency or urgent continence, meaning to say they feel like rushing to the restroom every now and then. If they don't reach the restroom, sometimes they can leak the urine in their underpants. Some people, despite of all these things, they can have incomplete voiding. Normally, a normal person, after passing urine, he will have some satisfaction or feeling of complete emptying of the bladder. Whenever there is enlargement of the prostate or cancer of the prostate, they feel they still retain some amount of urine within the bladder even after passing urine. So these are the early symptoms of prostate cancer or prostate enlargement. So some people will have burning urination or urinary infection. There can be blood in the urine, or even retention of urine can be there. So this is very important to decide whether it's benign enlargement or cancerous enlargement. If it is a benign enlargement, we have various options. We have medications can be given to improve the symptoms, or sometimes TURP or prostate removal can be done endoscopically for benign enlargement of the prostate. Whereas if it is cancerous prostate, all these things will not work. So what are the facts we should know about prostate cancer? This is most commonly diagnosed cancer in men in United States and Europe, next only to skin cancers. And in America, it is the second leading cause of cancer death. 1 in 6 American men suffer from prostate cancer. Fortunately, this incidence is relatively less in India. We don't have exact statistics, but it would be around probably 1 in 15, but definitely it is less compared to Americans or Europeans. Unfortunately, according to recent Globocon data, in Bangalore, Pune, and Delhi, it is second most commonest cancer among men. That is alarming. So, who is at risk of developing prostate cancer? Age itself is an important factor. So, prostate cancer is uncommon under the age of 50 years. It is common in 6th and 7th decade. So, generally, patients will be after the age of 65 or 70. But we do see some young patients presenting with these symptoms, and we do diagnose prostate cancers as early as 45 years, which is relatively rare. Family history is very important. The prostate cancers may have a genetic link or familial link. So patients with positive family history of prostate cancers, either in the father or brother, can have a much higher risk of developing prostate cancer. Even this prostate cancer is genetically linked with other cancers. If a person or family members are suffering from breast cancer, colon cancer, pancreatic cancer, adrenal cancer, ovarian cancer, stomach cancer, their risk of developing prostate cancer is very high because they share common genes sometimes. So genetic abnormalities will be there. So their risk of developing prostate cancer is relatively high. The risk gets even higher if several relatives have been affected with various cancers, in particular prostate cancers, and the risk goes up to 11 folds increase. So whenever multiple family members are affected with this, particularly father and brother is affected with prostate cancer, this individual's risk of developing prostate cancer is up to 11 folds. So it is very important whenever there is a family history of either prostate cancer or any of the other cancers which I mentioned just before, it is always better to go for early detection of prostate cancer by very simple ways I will tell you in my subsequent slides. So coming to the diet, as I told you, red meat intake may increase the risk. Exact risk quantification is difficult, but red meat is one of the factors which is implicated in the incidence of prostate cancer. Diet high in lycopenes and curcumin. Curcumin is nothing but haldi, it's turmeric, which we use in day to day. It's available in every household. To some extent, curcumin reduces the incidence of prostate cancer, but we don't have exact data on this. This is another recent paper published recently, just 2 years back, 2-3 years back. The increased sexual activity or increased frequency may reduce the incidence of prostate cancer. There's only one publication on this. So what are the symptoms of prostate cancer? As I told you earlier, the patients are often asymptomatic at diagnosis. In stage 1 and stage 2 prostate cancer, generally, they will not have any symptoms. That doesn't mean that they don't have any cancer. So even in early stages of the prostate cancer, they will not have any symptoms. In India, we don't meet urologists unless we have any symptoms. Whenever the symptoms are there, generally it is in 3rd stage or 4th stage. So this is very important to understand. Even if you don't have any symptoms, please go to your doctor and check. Do some tests, do some examination. Doctor will tell you what is the risk of having prostate cancer. That's very, very important. So in the early stages, usually they will not have any symptoms. This is when you should go to your doctor to check for early detection of prostate cancer. So as I told you, early stage cases are either diagnosed because of examination of the prostate done by a doctor. He will feel the abnormality in the gland, or because of a simple blood test, which is called PSA, stands for prostate specific antigen. When we do this in a screening evaluation, as a screening evaluation, we do these things, we can detect prostate cancer early, even when a person is not having any symptoms. So presence of symptoms, as I told you, usually indicates advanced disease. So you should go to a doctor when you don't have any symptoms. However, if a person misses or missing the diagnosis of prostate cancer at an early stage, what will happen? He will generally, the disease will progress and he will come back with symptoms in an advanced stage or stage 4 disease or stage 3 disease. We call it a stage 3 disease as locally advanced prostate cancer. They can have hematospermia, it is called blood in the semen. They can have retention of urine, complete blockage of urine requiring catheterization. There can be blood in the urine. These are all common in the stage 3 disease. When it comes to stage 4 disease, where the tumor has gone to other organs, likely to the bones, to the lung or liver, where they can get swelling of the legs, weight loss, and typically they will complain with bone pain or back pain. And sometimes there can be kidney failure because of obstruction to urine flow. How is prostate cancer diagnosed early? It happens only by screening. If you want to detect your prostate cancer early, you go to a doctor for screening. When you don't have any symptoms, that is the right time to go for screening. What are the recommendations? After the age of 50 years, all men should undergo this PSA test and examination of the prostate, and depends on the doctor's suggestion whether it requires any further evaluation or not, that to be decided. If you have family history of any of these cancers, in particular prostate cancer, one should start checking or one should start going for screening from the age of 40 or 45 years. So when you go for a screening, these two are the tests done. Serum PSA, as I told you, which is a simple blood test, which costs about 800 to 1,000 rupees, which is recommended every yearly for all men after the age of 50 years. And obviously, doctor will examine the prostate. By these two, if abnormal PSA value is there, normal PSA value is around 3 to 4 nanogram per ml. If it is say 6 or 7 or more than 8, probably it warrants further investigation. Or sometimes doctor can examine the prostate if it is hard, which is suggestive of cancer. If everything is fine, if PSA is normal and prostate examination is normal, you don't need any further evaluation. You check the same maybe year on year. If it is abnormal, either PSA is abnormal or prostate examination is abnormal, definitely we suspect prostate cancer. In that case, to confirm, we need to go for prostate biopsy. If biopsy is proven to be cancer, if biopsy, based on the biopsy, if it tells that yes, cancer is there, then we need to understand what is the stage of this cancer. To understand that, we go for MRI scan or PET scan is performed to know the exact stage of the cancer, because further treatment planning is based on stage of this disease. So it is very imperative to understand what is the stage of the disease. So these are various stages of the disease. You see stage 1 and stage 2, where the disease is depicted in red areas. So it is confined to the prostate. It has not gone outside the prostate. So there is very small tumor which is present here. It is stage 1, and this tumor, if it is present on both sides of the prostate gland, it is stage 2. Once it goes outside the prostate gland into the adjacent seminal vesicles, it is stage 3. Sometimes it can infiltrate the bladder or even the rectum. It is stage 4 disease. Still, we call it as locally advanced disease. Some subset of patients can be still cured by multimodality treatment, even if it is stage 3. Stage 4 disease means it has spread to other organs, other distant organs. So we can detect that by PET scan. When we do PET scan, it is whole body PET scan. We detect whether the disease has gone to other parts of the body. Particularly, prostate cancer has some predilection to spread to the bones. You can make out all these light up areas in the bones. This prostate cancer has gone to so many bones. So this is stage 4 prostate cancer, where it is not possible to cure, but definitely we can control this. Even if it is stage 4, we can give them good quality of life and they survive for 5 to 6 years. That is the advantage of detecting prostate cancer early. What are the treatment options? So treatment depends on various factors. I will not get into the details of all these things. It depends on age of the patient. It depends on life expectancy, general condition of the patient, whether the patient is fit for any treatment options. It also depends on, mainly on the stage of the disease and grade of the disease. Some tumors are very aggressive tumors where we need to give aggressive treatment. Some are less aggressive where we don't need to give that aggressive treatment. It also depends on patient preference. Some people prefer to go for surgery, some people prefer to go for radiation. It also depends on their preference. We should respect that in the decision making. So these are the general treatment options whenever we call it as a low risk disease. So very less aggressive tumor is there in an individual and his life expectancy is limited, maybe 3 or 4 years or 5 years, we don't even give any treatment. We just give some supportive treatment. For other patients with long life expectancy, young individual with a long life expectancy of more than 8 to 10 years, definitely they would require better treatment options like surgery and hormone therapy, provided it is in the stage 1, 2, or sometimes even stage 3 disease. We offer them surgery and hormone therapy plus radiotherapy. When we use this combination therapy for stage 3 disease, it is called combination therapy. By this combination therapy, we can at least some subset of patients can be cured. Otherwise, if it is in stage 1 and stage 2, most of the tumors can be cured. At least the cure rate for stage 1 and stage 2 cancers would be around 97 to 98% with surgery alone or sometimes with hormone therapy and radiotherapy alone. When it comes to stage 4 cancers, where the cancer has gone to the bones, to other distant organs, it is incurable. In such cases, to control the disease, we go for hormone therapy and sometimes chemotherapy in a different sequence we use. There are a couple of injections available for hormone therapy and some oral tablets are available. So we go in a particular sequence to optimize and to enhance the survival of this patient. So when it comes to surgery, in the recent years, robotic surgery is very common to remove the prostate because of its very precise surgery. This is a very precise surgery because we'll have 10 times magnification and the instruments, robotic instruments can deflect around 540 degrees. It's called endo-wrist movement. A miniature instruments will go inside of the body through a keyhole and it perform the surgery. Of course, perform the surgery. It's like a master slave principle where the surgeon, experienced surgeon, will sit on the console and he controls the movement of all these. Say surgery with 10 times magnification, the blood loss is significantly less. At least at our place, the blood transfusion rates have reduced significantly. Our blood transfusion rate is around 1 to 2%. Otherwise, if you go for open surgery, more than 50% of them would require blood transfusions. So this is a very accurate surgery. This is a very precise surgery. Because of this, person would recover, or patient would recover very fast, and he can go to his work very early, less wound complications, and overall complications are less, and it gives better outcomes compared to open surgery and laparoscopic surgery. This is almost standard of care in most of the prominent cities in India as well, and it is standard of care in Europe and USA. So this is the prostate gland removed after surgery. So to recap whatever we have discussed, because that is more important, how to reduce your risk factors. Choice for good health is follow testing guidelines. Regular screening is very important. The screening is recommended after the age of 40 or 50 years for all men and women. Know your family history. Accordingly, discuss with your doctor. Eat a healthy and well-balanced diet. Get regular exercise, at least 4 to 5 days a week, maybe every day. Minimum 30 to 45 minutes is required to prevent most of the cancers. Don't smoke or use tobacco products. Avoid excessive alcohol consumption. Tobacco responsible for almost 1/3 of all fatal cancers. More than 60 cancer-causing agents are found in tobacco. If a person stops smoking before lung cancer develops, the lung tissue slowly returns to normal. This is very important. So nicotine replacement therapy or tobacco cessation counseling have been shown to be very effective in helping someone to quit tobacco. Please adopt these things. And one important thing an employer can do is ban tobacco use at the workplace. By banning this, most of the persons who smokes can be prevented or avoided. Again, 1/3 of fatal cancers cases could be prevented by better nutrition and physical activity. Moderate to vigorous activity for minimum 30 to 45 minutes is very important. 5 or more days a week has shown to reduce the risk of breast cancer and colon cancer in the studies. So eat at least 5 or more servings of fruits and fresh vegetables, preferably organic vegetables. I urge you to grow your own vegetables on the terrace garden, which is very important. We do that one and we get almost 60 to 70% of our requirement from our terrace garden. And choose whole grain food. Try to avoid processed food. Limit your intake of red meat. Maintain a healthy weight, which is very important. The BMI should be around 23 to 24 or less than that. The balanced calorie intake with physical activity is very important. Lose weight if currently overweight or if you're obese. If you drink alcohol beverages, at least limits its consumption or reduce its consumption. Thank you. These are my contact details. If you wish to know anything more, you could contact me. This is my number and this is my email. Thank you for the opportunity. Thank you for patient hearing. Thank you.
Thank you, Dr. Raghunath, for that very informative session. We have a few questions for you now. The
Yes,
first one was, how does cancer start?
Come again?
How does cancer start? Like any form of cancer, how does it start?
Yeah, it generally, normal cells will be there. To become an abnormal cell, it takes probably 8 to 10 years. The normal cell, because of its genetic abnormality within the cancer cell, within the normal cell, it becomes cancer over a period of 8 to 10 years. Once it becomes an abnormal cell, it keeps on multiplying in that particular organ. Once it achieves several multiplications, okay, then only you can make it out on either you can feel it as a lump or you can detect on imaging, that is CT scan or MRI scan, you can detect that. So it always starts from a single cell, single abnormal cell, which starts multiplying, and over a period of time, this multiplication is enough to produce a lump. That's where you detect this.
Thank you, doctor. The second one was, how does one mentally prepare for treatments, because it can be painful?
It's a myth. Painful means any surgery is painful, and commonly people think chemotherapy is painful.
Yeah.
It is actually, chemotherapy is not physically painful, it is mentally painful. The process of undergoing chemotherapy, some people explain it as very painful. There won't be any physical pain. Going to the hospital and receiving the chemotherapy repeatedly, maybe generally 6 to 8 cycles of chemotherapy is required. Going to the hospital, checking all those things. So physical strain will be there and mental pain will be there. So by discussing with the treating physician, and even now psycho-oncologists are available everywhere. So we will get exact information what we are undergoing. When we get that information from a treating doctor, probably our mental pain and agony and even anxiety can be minimized. So these are all part of the management. So this should be discussed with your doctor.
Yeah, thank you, doctor. I think this is a very interesting question. Is there a strong relationship between corona and cancer?
No, answer is no. At the moment, our knowledge about COVID is just 7-8 months old.
Yes,
So in
yes.
the years to come, we don't know how it is going to unfold.
Very true.
At the moment, there is no evidence to say that COVID can cause malignancy.
Yeah. Okay. So the next question was, what is the goal of cancer treatment? Does it completely go away, or should I be worrying about a relapse?
I will give a best example of prostate cancer. Many of our prostate cancer patients are cured if they come and if they get diagnosed in stage 1 and 2. even few stage 3 disease prostate cancers can be cured. When it comes to kidney cancer, if it is in stage 1, more than 98% we can cure. Stage 1 kidney tumors. Maybe stage 2 kidney tumors can be cured maybe around 75 to 80%. So it all depends on stage of the cancer. If we early detect any cancer for that matter, the cure chances are very high. The success rates are very high. And even the treatment required can be minimized. With surgery alone, or sometimes with radiation alone, you can cure. Once it becomes stage 3 or stage 4 disease, despite of multiple treatment options, despite of spending, lot of money, we may not be able to cure. That's very, very important.
Yeah. The next question was, is having food with beta carotene in it helps fighting cancer?
Yes. There are so many factors in the diet. Beta carotenes are there, lycopenes are there, many immune boosters are there, which definitely modulates our immune system to fight against our own cancer cells. If a small cancer cell is growing in our body, our immune cells can detect that, and that our own innate immune cells can kill those cancer cells. Sometimes our immune cells may not be that active. So by exercise, by walking, by good diet, probably we can enhance our immunity so that our own immune cells can fight against the development of these cancer cells.
Doctor, can you just give a few examples of any food that is rich in beta carotene that we can include in our daily diet?
Any fresh vegetables, fruits,
Okay.
contains a lot of beta carotenes.
Okay. So the next question was, what is blood cancer? What are the causes and treatments?
I don't treat blood cancer. I will not unnecessarily get into that and confuse you.
Yeah.
Blood cancer is nothing but there are blood cells. Basically, 3 types of blood cells are there: WBCs, RBCs, and platelets. So multiplication of WBCs, uncontrolled growth of these WBCs is called blood cancer. There are different types of cancers. Leukemia is there, chronic lymphocytic leukemia, chronic myelocytic leukemia, acute lymphoblastic leukemia. There are different types of leukemias are there, and lymphomas are there. Lymphomas are, it is nothing but arising from the lymphatic tissue.
Okay, thank you, doctor. So the last question was, is thermal mammography a reliable tool for diagnosis of breast cancer?
Yes, certainly yes. My answer is certainly yes. Mammogram is recommended after the age of 35 to 40 years, depends on the family risk of developing breast cancer. If you do this mammogram, maybe after the age of 30 or 35 years, yearly once, you can certainly detect this breast cancers in a very early stage, and it is potentially curable if you detect in a very early stage.
Thank you, doctor. Thank you so much. And over to Saiti now for the vote of thanks.
Thank you.
Thank you, Dr. Raghunath, for this informative session on cancer and for the emphasis on prostate cancer, which has been on the rise in our country, and it requires a lot more awareness from everybody around us because it's a very new topic which is being discussed. So it's great that we could have you to share, you being very renowned in that area, to share information regarding that with us. I'm sure this session is very useful to everybody who has attended, and I assure it has had an impact on us, and we will all make the necessary lifestyle changes to prevent cancer and also go ahead with all the necessary precautions and undergo regular checkups for early detection. Thank you, doctor. I would also like to thank Lions Club International for giving us a platform to conduct awareness sessions like today. Further, I would like to thank and extend my my gratitude to District 317E, specifically to the District Governor of District 317E, Lion Bhanumurthy Reddy, to Lion Bhaktavatsala Reddy, the first Vice District Governor, Lion Vinuta Prakash, the second Vice District Governor, Lion Saraswati Ramana, the GST Coordinator, and Lion David Abraham, who is the DC for Cancer Awareness. This session has been conducted by Lions Club of Lcb-Aikya. We are basically a service organization who go out and do activities, any service activity including awareness sessions. So I would like to specifically thank Lion Santosh Suresh, the president of Lions Club of Bangalore-Aikya, and the service chairperson, Lion Nirmala Raghunath, for conducting this event today, and also the entire team for managing this event. I request each of you to follow Lions Club of Aikya for more events of this kind on our Instagram pages and on our Facebook page, which is Lcb_Aikya, and also to follow this YouTube page for more awareness sessions. Thank you, Doctor. Thank you, everybody else.
Thank
Hope
Thank you,
this
Ms.
was
Saiti and Shruti. Thank you.
you, Doctor. Thank you.
Thank you, Doctor.